I think a great doctor is someone who really cares for the patient. And every patient is an individual, and to see them for who they are and what they need, from the smallest to the biggest detail of their care, so that we can make sure that we really look after the patient as a whole. I've always liked science, and growing up I had my family physician, and I really appreciated the great care my family physician gave to me and my perception that that's what he was doing for every patient, always like a full waiting room anytime I would go. And I always just aspired to fill that type of role someday. And that was the beginning of my journey to finding ear, nose, and throat, and then eventually pediatric ear, nose, and throat as a great specialty that I've enjoyed so much for years that my job is not a job, it's just what I love to do. The most common things that we see are the recurrent ear infections, sometimes that we just require following a child because they're going to outgrow them after treatment with antibiotics, to needing ear tubes, which is a very common surgery we do. And then some of the things that would be more involved might be a child who has recurrent sinus infections that requires sinus surgery. And then we also see children oftentimes with congenital neck masses. So in other words, a lump in the neck that's been present from earlier in their life, where we'll remove those. What's most essential is listening to really understand what families are thinking about when they come in, so that I'm able to allay their concerns. So I definitely appreciate developing that connection at the beginning, that I can understand what brought them in. And then ultimately, we all know that we're trying to get their child healthier, but we just want to get there together so that it's a journey that we carry through together. We also see that families bring in their other children for our assistance, which is really a beautiful thing, that we get to know the whole family. And then the next generation, so those kids that are our patients, that then we actually get to see their children, which is really such a beautiful thing.